Howard Knox, 52, abdominal pain and fever, 152 over 90, tachy at 120. Couldn't get an IV.
Wonder why. Hello, sir. My name is Dr. Robbie.
Howard.
This is a teaching hospital. I'll be supervising Drs. McKay and Dr. Whitaker and student Dr. Ogilvy. Hey,
Hello.
how you feeling?
Not so great.
Okay. Princess, what's free?
Trouble one, her left.
Tachy at 128, pulse ox 92 on 2 liters.
When did the pain start?
It's been on and off for about a week.
And where do you feel it?
All over. It started on the left, and now there's some on the right.
How about that fever?
Since last night, I was burning up, and then I had chills pretty bad.
Can't find a vein here. We'll try for midline.
Let us know if this hurts. Sorry.
And on this side?
Yeah.
Sorry.
Guarding with no rigidity for pain, 100 of fent IM. Plan Dr. Whitaker.
Blood cultures, lactate, Zosyn. We're gonna need a CT to figure out what's going on. Yo, it's not gonna work.
Yep, right neatly, 10-minute chip counts.
Howard, for the scan, we're gonna have to lay you flat on your back. Can you do that?
I could 10 years ago, but now it's too hard to breathe.
If we can't lay you flat, then we're going to have to put a tube in your windpipe to help you breathe. Are you okay with that?
Intubation with rapid sequence induction.
No, we can't lay him down.
No, the tube will go in your nose while you're awake, sir.
My critique here, really before we get into this, is that Dr. Robbie and the staff went to immediately informing the patient if he could not lay flat, he would need intubated. My critique with this is that when we have a patient in the ER that needs a CAT scan, sometimes they're in so much respiratory distress, they can't lay flat. Sometimes we actually place them on BiPAP. We put them on BiPAP, we place them in the CAT scanner. Other times we cannot CT them because the respiratory distress is so bad. At a minimum, we're at least gonna see what we're working with before jumping immediately to intubate them. Dr. Zach, what are your thoughts on intubating a stable patient that can't lay flat?
So, intubating a stable patient that can't tolerate or lay flat for a CT scan is a very realistic scenario. It's something we actually get called in a lot for as anesthesiologists, probably more so than ER doctors because you guys are busy taking care of unstable patients. So when we got a stable patient that just needs some imaging done or something, not an uncommon call. Usually we see this in pediatrics, people with severe autism, people that are severely agitated, inebriated, and also people who can't tolerate laying flat due to severe obesity or other pulmonary condition.
Wait, so would you jump right to intubating them, or what are your thoughts on that?
I would give them a trial, especially if it's just a CT scan. It might be super quick. It literally could take 15 seconds. He might tolerate laying flat for 15 seconds. That was like my initial, wait, let's just give him a try. Let's see how it works. Let's try CPAP. Let's try BiPAP, right? Let's put something on his face. Now, intubating is something we can do, but it's not the first thing I would go to. You know what I mean?